Hey, Debbie and Miranda.
Hi.
If either of you end up having questions or anything you want to put in, you'll have to just unmute because I'm not really good at seeing the chat when I'm not facing the computer. So.
Okay.
Yeah.
I just can't send you the notification that I actually did. It just keeps sending to them.
I saw that. Could you try printing it as a PDF and then seeing if that'll work? Okay, well, we'll go ahead and get started. I know some people are on Zoom today. I think as we settle in, more and more people are essentially getting all the lovely illnesses that, might not be COVID, but are other things we get. So same thing has certainly happened to my child. I'm sure anyone else who has kids has found that out too. I didn't know what para-influenza was till it's the thing. All right. I'm myself a baby. Let me check in the people who are zooming in. And then I'll go ahead and call roll. Okay, Sasha. Michaela. Sophia. Miranda. Huh? Let's see, turn on today. Josh? Amanda? Let's see if everybody is awesome. Lola, Brittany, and Hannah. Awesome. Did you get your dry erase marker back? I didn't. I already wanted to hold on to it. No, I think it like was here and someone else took it, so I owe you a driver.
No, that's okay.
I have a whole pack that I'll bring in starting Thursday, so you can have one.
Yeah, I always think most people, they always go to- I don't.
Okay, cool. I realized after I got my car, I was like, dang it. Okie dokie. So, fun fact about today, I have, oh good, wait, I just found the folder. For some reason, this folder wasn't showing up. Okay, the one for the links to the videos are is, but I will have to, when I get back to my computer, put up the PowerPoints for nervous system organization. Because for whatever reason, it didn't populate when I copy things over. So I will do that. And I found some replacement images that I use that I'll use today. So but we do have the links and videos. So yes, today we are going to talk about nervous system organization. This is our last like focus on the basics today. Thursday, y'all have your first quiz. Sure, I'm not lying about that, but I'm almost positive. Yeah, so it'll just be these first 3 sections we've talked about. So use your study guide assignments, your SGAs to study for it. It's, if I'm remembering correctly, 6 multiple choice questions, and then you flip it over on the back, and there are 2 sets of 4 matches. So pretty low intensity. Most people can finish it in about 10 to 15 minutes. So we'll just do it at the beginning of the class, and then, you know, plan to, when you're done, just like, I don't know, you can go on your phone or have something else to read or something like that, just so people will say, come on the phone. And also on Thursday, I feel like all the fun stuff is happening Thursday. Also on Thursday, we will do our first case study that we'll work through together. So make sure for sure on Thursday, you have your Ogden book, or if you're using an ebook, that you bring something where you can access it, essentially. So we'll work through the case studies there. I did pull some questions people had from their SGAs for today. We will definitely make sure that we get to those. And yeah, today we will talk about basic neuroanatomy. In honor of it, I'm wearing my neural network dress. It glows in the dark, but that's not very important. And then, yeah, and then I also have my neuron necklace on. So every once in a while, I like to geek out with psych stuff. I noticed today. So. If anyone else likes geeky clothing, the website I really like is Spaha, SBAHA. They have a lot of really cool stuff. So, but you have to catch their sales, just warn you. Like, had I not caught this dress on sale, I think it would have been like $60. It's like, nah, right? So, but their sales are pretty good. Okay, so at the start of your chapter, there's this portrait of RS. When it talks about how stroke can affect the brain. And it really, honestly, for stroke, mostly depends on where in the brain the stroke happens, right? So like a stroke in your occipital lobe is going to give you totally different results. Deficiencies than something that happens up here in your prefrontal cortex, for example. Also, sort of how big the stroke is will reflect how serious the implications are. You can have massive strokes that really have an immediate impact on your functioning. You can also have what are called mini strokes or TIAs, and these you might not even know you have, right? They might be so minor. It's almost like you could zone out for a few minutes and then just sort of go on with your life. Traditional stroke symptoms we look for are things like difficulties in motor functioning. When someone's having a stroke, often you see like one side of their mouth droop, things along those lines. In the case of RS, he had his left arm rigid, and he made little attempt to use it. And he could do activities, but he was really apathetic about it. He lost interest in everything. And this is something that's pretty common with a lot of neuropsychological issues people have, is that they may also experience what we typically think of as like psychiatric or psychological symptoms. Sometimes those are also symptoms essentially of whatever brain damage has taken place. Sometimes those are as a result of the fact that now you have decreased functioning, right? Sometimes it's a combination. But for example, in multiple sclerosis, it is a demyelinating disorder. So what that means is, if you remember again, basic neuron anatomy, they have myelin sheaths right around the axon to protect it and to make transmission faster. What happens in MS is that those deteriorate. So this makes it much harder to have efficient transmission of signals. It'd be like if you wire stripped like an extension cord and then try to use it like normal. And then it also can affect things other than what we traditionally think of as the symptoms of MS. So symptoms of MS, we tend to think of like motor difficulties, visual problems, things along those lines, but depression is actually a hallmark symptom of MS because this demyelinization also affects sort of the transmission of neurotransmitters that are implicated in depression. So what is a stroke? What happens in a stroke? No.
It's like loss of blood flow to the brain.
Exactly. Yep. Interruption of blood flow to the brain. And what happens when you interrupt blood flow to the brain, or really any part of your body? Behavioral movements. Go ahead. Yeah, cells die, right? That's how you get the behavioral symptoms. It's like if you have to use a tourniquet on someone's leg, right, to save their life, so they don't bleed out. Now we can do it in such a way so it doesn't necessarily mean you're going to lose the limb, right? But if you cut off the blood flow enough, that person might have to be amputated, right, below wherever the tourniquet was. Because just when tissues don't get blood, they don't get oxygen, they don't get the nutrients they need, it's not great, right? So same thing when the brain doesn't get blood, right? Not a good thing. Not getting oxygen, not getting what it needs. All right, what's an ischema? I've heard of it as ischema. Yeah, I know. Exactly. So it's sort of, I want to say like a less of a problem, because it's still obviously a big problem, but not quite as severe as a stroke where you have like total blockage typically. All right, and how about the hemorrhagic or hemorrhagic stroke? What happens in that case? Yeah. Exactly. So there you have not only, problems with blood flow, but it's in the brain that the vessel has burst. And so you have bleeding into the brain. Anytime you have swelling or extra fluid, something that shouldn't be there in the brain, a tumor, say, that's problematic, right? Because that starts to take up space that the brain tissue is supposed to take up. Anytime brain tissue is squished, right, stretched the way it shouldn't, supposed to be twisted, it could potentially cause damage. So yeah, very potentially problematic. So in this little case of RS in your book, his was in the right frontal cortex, so up here. And it included the precentral gyrus, which looks at motor ability. Now, of course, one of my videos is also busted because, why would life be easy? But I think I'm going to be able to find a different one about stroke pretty easily. Yeah, we don't need an hour of some guy talking about stroke. Here, I like little, you know what, this one actually looks better. We got a brain on page, so hopefully.
Writing's not that easy, but Grammarly can help. This sentence is grammatically
This is a sample. Okay.
A stroke occurs when the blood flow in part of your brain is blocked. After just a few minutes, the starved brain cells begin to die. Normally, the brain receives blood via two major pairs of arteries, which branch throughout brain tissue and supply your brain cells with a constant flow of oxygen, glucose, and nutrients necessary for their functions. In one type of stroke, ischemic stroke, an artery in your brain narrows or becomes completely blocked, preventing normal blood flow.
So ischemic stroke is very similar to a heart attack. It just happens in the brain instead of in your heart, essentially. The same thing happens for people who have a heart attack, where it's typically something like plaques build up due to cholesterol, things along those lines that narrow the blood vessel or even cut it all the way off.
The blockage may be caused by a blood clot, also called a thrombus, which forms in an unhealthy artery of the brain. The lack of blood flow causes the tissue the artery supplies to become starved or ischemic. Similarly, the blockage may be due to an embolus, a blood clot that forms elsewhere in the body and travels to the brain.
And again, just sort of side note with that, that can also happen with the heart, where you might develop, say, a blood clot in your leg, and then it would travel to the heart and you could have a heart attack that way, or again, a stroke.
The embolus lodges in a narrowed artery and obstructs blood flow.
These are all basically different ways to get to the same terrible end result.
In contrast, during a hemorrhagic stroke, abnormal bleeding disrupts normal blood flow. For example, in an intracerebral hemorrhagic stroke, a blood vessel bursts, spilling blood directly onto your brain, while robbing the intended tissue of nourishment. Both the hemorrhage and ischemia destroy brain tissue. A subarachnoid hemorrhagic stroke occurs when a weak spot in a blood vessel wall, called an aneurysm, bursts and leaks blood into the tight space between your brain and your skull. The high-pressure bleeding results
One of our case studies later in the semester will be someone who experienced this in particular.
in serious damage to brain tissue. Immediate treatment for your stroke may help to minimize brain cell injury and death. If you have an ischemic stroke, you may be given medication to break up the clot causing your stroke. Later, your doctor may recommend surgery, such as carotid endarterectomy, to reduce your risk of having another ischemic stroke. In the case of hemorrhagic stroke, emergency surgery may be necessary to repair damaged arteries or reduce the pressure of the blood on your brain.
So sometimes maybe not as much with this, but other times the brain is swollen. What they'll do is they'll actually remove a piece of the skull just to relieve the pressure of the brain. And then eventually put it back in place.
You may be given medication to help the brain's blood flow return to normal.
And obviously, recovery can be very complex depending on the location of the stroke, again, how severe that stroke was as well. Alrighty, so the next thing we're going to do is just go over some brief definitions from your book. Again, I don't know where my preference for this particular one went, but I do have Zoom. Behave yourself. I do have some great photos I was able to pull up here. So one of the things your book focuses on a lot is sort of thinking about how we describe directions within the brain. So rostal is essentially beak is what it means. So if we were thinking about like where is a bird's beak, right? That's sort of how you know where rostal is. Caudal would be tail, right? So back here. Dorsal, even if you hadn't looked it up, just intuitively knowing what you know, where would you think dorsal was? The back, yeah, like I think about like a dolphin's dorsal fin, right? Ventral is stomach, or inferior, it's sometimes called, and dorsal is also sometimes called superior, because again, if we orient like you're a dolphin, right? Then superior on top would be your dorsal. All right, anterior or frontal is in the front. Posterior is behind. The posterior, your derriere, right? So it's a nice way to remember that. Lateral is just on the sides, right? And then medial is down the center. Ipsilateral are structures that are on the same side of the brain, which would mean contralateral would be on opposite sides of the brain. Yep, pretty simple. Bilateral would be if we have one of something in each hemisphere. The overall structures of the brain are largely bilateral. So we have our frontal lobe on the right, but we also have a frontal lobe on the left, for example. Proximal means close. Distal means far away. Obviously, distal is going to be relative here, right? Like the human skull can only be so big. It's not going to be miles, but you know, the occipital lobe versus temporal lobe versus frontal lobe, right? Versus the temporal and parietal lobes. Temporal and parietal lobes are pretty proximal. Occipital and frontal lobes, distal, opposite sides of the brain. The other thing we'll start to talk about, and certainly this will come into play when you think about your short paper you'll write for this class as well, is movement of information within the brain, right? So it's not like we magically get a nerve signal out of nowhere and it just sort of chills in one part of the brain, right? All the parts of the brain are interconnected and some communicate with others more often, right? And so afferent, A-F-F-E-R-E-N-T, is movement toward a brain structure. And if we're thinking from outside the brain in, these are typically your sensory pathways, right? So you get information from the world around you, and it goes into your brain. That's afferent. So this is the typical five senses we think of: sight, sound, smell, taste, touch, but then also some other senses that aren't normally sort of classified as kiddos, but we have like a kinesthetic sense of like where our body is in space, right? That comes into play in a lot of neurological disorders. Also, when that's disrupted even temporarily, it can be an issue. So if you or a small person you know, child, not like someone who's vertically challenged like me, Who's ever had an ear infection, you'll find that like they're not as good at walking straight as usual, because the ears are part of how we keep our balance, right? Or a really nice example of that being off came this summer when Simone Biles got what's called the twisties in gymnastics. And essentially what that is you lose your sense of where you are in the air, which is super dangerous if you're like doing flips, right? So she posted some videos where she was trying to do her dismount off bars, and like she's supposed to do 2 twists, 2 flips, and was only able to get like half a twist. But like in her mind, she was doing 2 twists, right? It was like her body wasn't listening to her mind. So anytime those are off, whether it's temporarily with something like the twisties or a cold, or it becomes permanent from some sort of brain damage, that can be really problematic in terms of not knowing how to navigate your space, running into things along those lines. Efferent, E-F-F-E-R-E-N-T, is movement away from the brain structure. So that is your motor pathways. So you get the sensory information in, afferent, your brain processes it and tells your body what to do, right? Efferent. So this could be something as simple as, oh, there's, something coming up that I probably don't want to step on. I should step to the side, right? Rather than being like, which we do sometimes when we're not paying attention. Right, but again, if that becomes a permanent part of how you navigate the world, it can be potentially very dangerous, right? And some people will require assistance, be it by actual physical mobility assistance like a cane or a walker, or even something like a canine assistant, even if they're not needing it, the canine for sight when they have disorders like this. So,
Hey, Dr. Myers,
yeah,
I just want to verify afferent is with an A and efferent is with an E.
correct.
Thank you.
No problem. Thanks for asking. Alrighty. So the next thing I want to hit on are, well, I'm going to get to the lobes of the brain, but actually this site might be, thank you, University of Queensland. You might be helpful in general. Yeah, okay, cool. So there are 3 main components of your nervous system. The one we tend to think of when we think of the nervous system is the central nervous system. What does that entail? Yeah, it's just your brain and your spine, right? But we have nerves throughout our body, right? We have motor neurons and we have sensory neurons. So those are part of what's called the peripheral nervous system. So what's shown here with the brain and the spinal cord is the central nervous system. And where you start to see all these things branching off, those would go to your peripheral nervous system. Then we have the somatic nervous system. And these are the spinal and cranial nerves to and from the sensory organs and muscles, joints, and skin. These produce movements and get these are sort of both motor neurons and sensory neurons, so they also move sensory info to your spine and your brain. Disturbances in the somatic nervous system are often the ones we notice the most because you can just see them behaviorally if you're observing someone, right? The autonomic nervous system, though, are the ones that are like super scary if it's off. So the autonomic nervous system does your body's internal organs. So it controls things like your breathing, your heart, right? Even things like your digestion. So if those are off, that can be very problematic. And I mean, obviously, if like something like control to your breathing or your heart is just non-functional and we can't fix it, unfortunately, you won't be able to survive almost like a ventilator, right, or something along those lines. So we have the CNS, and then we talked about the somatic and autonomic. There we go. How are all these things protected? What sort of armor do we have in place for our central nervous system?
It'd be like the skull and our like vertebrae.
Exactly, yes. Skull and vertebrae definitely are the like most obvious ones for the CNS. But then we also have things like the cerebral spinal fluid, which is in our brain and our spinal cord and kind of provides a cushion. So just like any other fluid in your body, if you have too much or too little of that, that's problematic, right? And then there's something called the meninges. And I will actually bring dry erase markers. So I will just write that up real quick for y'all. Although you have your SGA open, you can always do the version of that. So the meninges are a triple layered set of membranes that wrap our CNS. So we have an outer, a middle, and a one that cleans the surface of the brain. The outer one is called the dura mater, and that's a tough layer of tissue, basically like a sack for your brain. So the analogy is like carrying my brain around. But that's sort of what it is. Then there's the arachnoid membrane. This is very thin, delicate, follows the contours of the brain. This is your middle layer. It's called arachnoid because it's kind of look like a spider web. And then the pia mater, PIA, is the one that's really almost like shrink wrapped to the surface of the brain. So in addition to the skull, we have sort of these three layers of, like if you were shipping something to someone, right? The box is the skull, but if it's fragile, you're also going to wrap it, right? And if it's really fragile, you might like first wrap it in paper and then some bubble wrap, right? And then maybe throw those packing peanuts in there. That's sort of the meninges. So as I mentioned with the cerebral spinal fluid, too much or too little can be bad. So one of the things your book just mentioned in passing is what's called hydrocephalus, which translates to essentially water on the brain. This is something we see in about 1 out of 1,000 births in the US. So it's actually fairly common. And it doesn't have to be fatal. There's something that sometimes can be treated. And so it essentially means that you have too much cerebral spinal fluid. And it can be genetic, or it can be something that occurs due to injury, maybe during the birthing process or immediately afterwards. So in infants, this manifests with a bunch of different symptoms, but the most obvious one is just the size of the head. So the head circumference will be more than 2 standard deviations above the mean of, infant head circumference. And for those of you who've been around newborns, their heads are already fairly disproportionate, right? So this is pretty obvious when it gets to that point. So infants will be irritable, have failure to feed, so they won't gain weight. But that can be not as obvious because the head weighs more because of all the extra fluid. So it can be tricky. You'll also get a symptom called the setting sun, where if you like pull up their upper eyelid, they won't do an up gaze, so the iris will seem to set below the lower lid. And so this will lead to some sluggish reactions to light or like no visual response to light, even though they can physically see. In kiddos, similar, having a large head, they'll report headaches. Obviously, infants can't verbalize that to us, right? Vomiting, lack of appetite, problems making progress in school. Sometimes you'll have epileptic seizures, migraines, and for some weird reason, it's linked to increased incidence of the person being left-handed. Motor problems, just general delay. It can be linked to some social issues as well. If it's injury related, you might have totally normal development and then either stalling or going backwards once that happens. In adults, it's a recurring and increasingly unremitting headache. The vomiting, constipation, the same disturbance of gaze, they'll have confused states, but also interestingly, they'll do a lot of coughing and sneezing as well. So in general, they'll be delayed. And in adults, again, if it's after injury, we'll see a progressive deterioration of intellect and behavior. They'll also have a loss of insight into their own decline. So they won't admit something's going on. It can be diagnosed prenatally if it's happening in utero using ultrasound. So at that point, depending on viability, the parents, if they don't live in Texas, may or may not allow to terminate the pregnancy again for the well-being, right? Unfortunately, there are some cases where not even only just this, but other birth defects are so severe that even if the child is born alive, they don't survive very long and they're suffering the whole time, right? So parents may choose to terminate to avoid that suffering. It can be tricky. You might have to do repeated ultrasounds. Ultrasound is a lot better than it once was, but it's still not like a perfectly clear technology, right? So it can mislead. In adults, you would do like a CT or an MRI. And the way it's often treated is to put a shunt in the brain, so essentially like a drainage tube, and drain that excess cerebral spinal fluid. Obviously, you need to be very careful if you've got a tube going into your brain, right? And to watch for things like infection, blockage, disconnection, the tube moving around. Sometimes they'll also do compressive head wrapping. There are medications you can give. And instead of shunting the brain, sometimes they'll do a lumbar puncture to try to get excess fluid out that way. With shunting, they often can develop a normal intellect and develop normally. And if it's undetected in adults, it essentially can manifest and look like any other type of dementia. So like vascular dementia, dementia due to Alzheimer's. There are other things that can look like this in infants and children, other neurological disabilities. Metabolic diseases can actually look like this. So they're just having difficulty digesting food, right? It can look like they're losing weight for this reason, and their head can look disproportionate. And neuroimaging really allows us to make that differential diagnosis. Hydrocephalus is one of the things that if you do a brain scan, it's pretty obvious. Like your ventricles are enlarged, there's fluid where there shouldn't be fluid, and it's really easy to see even on the most crude of it. Like you could probably just detect this with an X-ray if you angled it correctly. So I just wanted to tell you a little bit more about hydrocephalus, just because it's something we don't talk about anywhere else in the class, and I think it's sort of interesting. When I took my graduate level version of this particular class, I actually did one of my paper presentations on that. So I have some know-how. An important thing that you'll often hear talked about in sort of medical settings, when you're talking about medication, is the blood-brain barrier. So this protects us from chemical substances. A lot of chemical substances can't cross this to protect the brain from the influences, but some can. Especially, say, addicting drugs, right? And this is the problem because drugs of addiction, again, if you're using them casually and it's something like alcohol, right, or even marijuana, which is legal in some places now, and you're using it in low doses, it's probably going to be fine. You'll just feel good because of how it manipulates your neurotransmitters. If you are abusing, it actually starts to really mess with how your neurotransmitters are created and maintained in your brain. Certain drugs of abuse, like ecstasy, basically cause your brain to dump all the neurotransmitters at once, and then it can actually take weeks to recuperate, get yourself back up to speed. If you're a habitual drug user, it could actually just like affect your brain's ability to produce things like serotonin in an unregulated manner, and you may end up having to be like on an antidepressant for the rest of your life just to help your brain make the neurotransmitters it make. So again, not like, oh, drugs are bad, right? But just like knowing that anything you overuse could potentially be problematic. Alrighty, so when we talk about the different types of cells in the brain, we tend to focus on the neurons. Again, that's what's on my dress. But one of the other really important cells is the glial cells. So what do those do? I'll give you this analogy. So if we were to think of faculty, students, staff, administration as the neurons of the brain, the glial cells are the people who really keep this campus ticking. So there are maintenance workers, like the people who work in the path, things along those lines. The glial cells are basically the support cells of the brain. They protect the brain and do other important activities. So for example, there are types of glial cells that secrete cerebrospinal fluid. There are some that just physically support or provide nutrients. There are some that are defensive. They're essentially an extension of the immune system in our brain. There are types of glial cells that actually make the myelin sheaths that we were just talking about are so important. And there are glial cells that are responsible for just clearing the byproducts out. They're the ones who take out the tracks, basically. And we know that when any of these things go wrong, right, it can cause some potentially really difficult problems in the brain. And in terms of types of neurons, we've already talked about sensory and motor. But there's one other main type of neuron in the brain, and that's the interneuron. And that just essentially is the link between a sensory and a motor neuron. And sometimes it's not quite that simple. Sometimes there are several layers of interneurons, right? But that's the one that typically you don't learn about in like interpsych. All right. So I want to get to the brain anatomy. And then if we have time at the end, we'll bounce back and talk about fun stuff like which part of your brain would you rather lose? I loved your responses, those of you who I was able to read that already, because all of you were like, this is an awful question. I don't want to lose any part of my brain. Fair, true. I hear you. Okay, so this is often what we think of when we think of the parts of the brain. If you think about the lobes of the brain. So this is all the cerebral cortex of the brain, and it's divided into two cerebral hemispheres. So this side view that we often see, we're really only seeing one of the two hemispheres. this would be reflected on the other side of the brain, right? So as I've been saying, frontal lobe is here. It actually goes a little bit further back than we typically think. Parietal lobe is sort of this general region. Temporal lobe is around your ears, essentially. And occipital lobe is back here. So some fun things. Obviously, again, these all relate together. So typically, if you get like a head injury, let's say you've been in a car accident or you're playing football in the NFL or something like that, right? We often tend to hit like the front of our skull, right? But then we'll have visual issues, like we might see stars or we might black out, right? And that's because, again, the brain's all one piece and it's in its sacs in the skull, kind of floating in cerebral spinal fluid. So it's sort of like jello, and it can kind of bounce around, right? So if you hit your frontal lobe here, the brain like smacks in your skull, essentially. But it doesn't just like stop there. It's got a, again, if you think of jello kind of wiggling, it's got a rebound. So when it does that, then the occipital lobe might hit the back of your skull. And then you would have issues there as well. And this is why we now take concussions very, very seriously, right? Because we know that they build up over time. We know that they affect more than just the actually hit part of the brain, right? So we are very careful about it. Each of these sort of does a different part. So the frontal lobe does executive functioning. This is like the CEO of your brain. So it does things like planning, sequencing. So it's what tells you I need to put my sock on before I put my shoe on, things like that. It also does things like attention, judgment, and social behavior. Interestingly enough, and maybe not surprisingly, for those of you who have experienced the effects of substances, this is one of the first things that's often affected by substances like alcohol, is your judgment, right? That goes out the window. It also does a lot with motor function, which is, I think, one of the forgotten roles that it plays that are really important. The parietal lobe up here, again, sort of like, if you thought of like where people wear a yarmulke, essentially that's where it would be. These are your bodily senses. So just a quick reminder, sensation is your objective reality. So like I touch a stove, it's hot, right? But it also does perception, which is your subjective psychological experience. So not only is touch this hot, but it's painful, right? So the parietal lobe tends to integrate all the information from your various sensory neurons. It also helps us with complex attention, things that help you with some of those subtests on the waist we were talking about that have to do with like working memory. We would store information briefly here. The parietal lobe is also what allows us to be self-aware. That's sort of our meta part of the brain. You're probably using it a lot as you sort of think about your own brain during this class. The temporal lobe, maybe not surprisingly, again, because it's by your ears, looks at auditory function. So not just hearing, but also speech and comprehension and memory related to language. So the ability to lay down new memory traces, but also the ability to get that information out of storage, which is just as important, right? And both your input and output of language are here, whether it's written or heard. And then your occipital lobe in the back is where you have your visual function. vision's pretty darn important to humans, right? So we kind of have a whole section of our brain focused on that. Alrighty, so again, this is kind of the big one that we talk about, but there are obviously more complex parts of the brain as well. So your book talks a lot about the limbic system. So let me just real quick see if I can get a good diagram of that. All right, there we go. Thank you, random people I'm Googling. Okay. The limbic system, pretty darn important as well. Does a lot of these, the functions that are, again, not these obvious ones that are controlled by the lobes, but things that are super vital, like memory, and things along those lines. Okay, so it's related to in functions of many important functions like emotion as well as memory. It was named for the connections between the olfactory system and the limbic lobe. However, subsequent studies haven't actually been able to prove that that's like the vital tie here, or if that direct connection even exists, essentially. But like so many things in science, we named it already, so we're gonna stick with it, right? Or the seventh in engineering too. My favorite is on cars, the defogger and the defroster. So I think technically your back one is called the defogger, when in fact it works better to defrost. And the front one's the other way. And it's, yeah, it was like, it was already named, so why should we change it? Right? So, all right, so you have the amygdala down here. And this is responsible for emotion and species typical behaviors. So for us, human typical behaviors, right? Which for us would be things like empathy, communication, things along those lines. The hippocampus, right behind it, does memory and spatial navigation. So I was mentioning earlier that there can be times where your vision is just fine, but you're still going to run into things, right? You might end up it might be because of a damage to the hippocampus. And the septum, which for some reason is not in the revision of your book, apparently. So apologies, some people looking for it could not find it. But the septum, not even on the side. Cool, but it says emotion and species typical behavior as well. So it's like the amygdala. So the initial analysis of this area basically said emotion is a product of the limbic system. In actuality, more recent research shows that this plays roles in emotional, sexual, memory, motivation, reward, and navigation, right? So it's not just creating emotions, nor is it the sole part of your brain responsible for creating emotions. The frontal lobe also does some of that. But it's involved in all of these things. Now, one thing I do want to point out, again, why this was called the limbic system is because right here is the olfactory bulb, right? So that's sort of where your sense-related neurons are processed. Because of just its physical location and connection to the limbic system, this is actually why sense is so closely tied to memory. Just because these things are physically close in the brain, proximal, if you will. And so, yeah, if you smell something right, it can be good, right? You smell chocolate chip cookies and it can take you back to grandma's house, right? But it can also be really bad, right? So I had veterans I worked at, when I was at the VA, veterans I worked with, who, if they smelled sand, which I didn't realize until they described it to me, that sand does have a distinct scent, right? It would take them back to the desert, right? And they might have a flashback. So it can be tied to both positive and negative emotions, right? And be a very powerful memory aid. So like in the late 90s, early 2000s, it was actually like a like pop culture fact, trendy thing that like you should wear the same cologne or perfume scent when you study as when you take a test. That somehow that would help you remember the info on the test more. That's a lot of info for one scent, right? I don't know how much there is to that. I'm sure it probably helps a little. But it was a thing you did back then. I remember doing it myself. And then I discovered that with my allergies, I probably shouldn't have been wearing perfume. Cool. That's why I was always like, very exam. So yes, this is very vital, very important. All righty. So the next thing I want to talk about are these regions of the brain that your book goes into. So we will start with the hindbrain. Okay. The hindbrain is called by some sort of pop psychology. There are lots of well-intentioned people who are not neuroscientists who read a little bit about parts of the brain and come up with their own theories and run with it. So sometimes you will hear this part of the brain called the lizard brain. It's not really a thing you'll ever see a neurologist or neuropsychologist say, right? But the idea is this is like one of the parts of the brain that probably evolutionarily developed very quickly. And it's because it's linked to things that keep us alive, essentially. So yeah, that makes sense. But yeah, if you ever hear someone say, well, you know, the lizard brain, you can just like into them. That's fine. So the brainstem or hindbrain is so important because it is responsible for our sensory and motor functions, and it plays a vital role in the regulation of cardiac and respiratory function. So if your brainstem is damaged, you can't breathe on your own because your brain's not healthy, or your heart might stop beating, even though nothing physically happens to your heart itself. And when people do overdose on drugs, particularly depressants like alcohol, so like those people either doing 24 shots in an hour or whatever, don't ever do that. That's a good way to die. I want any of you to die before your time, right? Basically what happens is alcohol has a depressant feature. It means it slows stuff down. And when it gets to those high concentrations, it starts slowing down to the point of stopping this part of your brain. So basically this part of your brain shuts off, which means all your basic functions you need to survive shut off. So yeah, moderation's great. It also regulates the central nervous system in general, and it regulates the sleep cycle and consciousness in general. So very, very, very important part of the brain. So the cerebellum, this part here, is gathered in the fovea or narrow folds. It almost looks like a mini version of the cortex, right? When you look at it that way. And it coordinates and helps learn skilled movement. So like when you are learning how to ride a bike, for example, this part is good, really working and making these connections. If you have damage to the cerebellum, you're going to have equilibrium problems. Postural deficits would be, you might like always be leaning too far forward, right? You always kind of like feel like you're falling. Also just impairments of skilled motor activity in general. The reticular formation not on this diagram, cool. But it maintains general arousal, not sexual arousal, just like awake arousal. So it controls sleep and waking in general. And then the pons and medulla here, there are many functions. They're also involved in waking and sleeping and locomotion or movement as well. All right, moving a little bit forward in the brain. We have the midbrain. So a few things here that come into play. This diagram is like the least helpful of the ones we've seen. Cool. There are other parts of the midbrain. So let me go ahead and try to get a Google image search. And like I said, when I get back to my computer today, I'll make sure I upload the right PowerPoint for you all. Okay. There we go. This one's gonna be more helpful. Literally, there were just diagrams and now they're gone. There they are. Okay, thank God. Just like, what is against me today? Okay. So, the midbrain here. There's going to be a lot more parts than your book actually covers. So just heads up that even the amount of detail Kolb and Wishaw go into is like kind of this level, right? And you can get like down this deep, right? Like we really have differentiated parts of the brain to very finite matters at this point in time. So the midbrain includes, gosh, you guys can't use any of this, it's not helpful, but it includes the tectum, which is located dorsally. So again, imagine you're a Dalton, so more far back on the skull. And it gets sensory input from the eyes and ears. The tegmentum, located ventrally. So again, I'm a dolphin, more this way. And that is getting input from the eyes and ears as well. And it has the superior and inferior colliculi. And those mediate the orientation of movement to sensory input. So those help you take the sensory info around you and direct your movement accordingly. So if someone's throwing something at your head, right? You should either put your hands up to try to block it or don't, right? And the tegmentum helps you do that. The substantia nigra is sort of this gray part here. And that is about reward and initiation of movement. So this is what helps you get started, and it's also linked to basically reward centers within the brain. There's something called the red nucleus, and that has to do with movement of your limbs in particular. And then the periaqueductal gray matter also does species typical behaviors. In this case, though, what I'm saying is like sexual behavior. And it has to do with your pain response. Then there is what is called the diencephalon. Let's see if any of these are more helpful. Not really. And it includes the hypothalamus and the thalamus. So I think one of these diagrams actually have those. So let me try to pull it up. You know, why would we have vital parts of the brain like the hypothalamus? Hypothalamus and thalamus. All right. Yeah, so we looked at this diagram of the brain before. The hypothalamus and thalamus are these two more central parts. The hypothalamus interacts with the pituitary gland. The pituitary gland is the controlling gland of all the other glands in your body. It directs you to secrete things like hormones, insulin, things along those lines that your body just needs to function. And it participates in nearly all aspects of motivated behavior, like feeding, sexual behavior, sleeping, emotional behavior, and it's also involved in some autonomic things, including temperature regulation, very important, and endocrine function. And then the thalamus, part right in the center, relays sensory information to appropriate targets. It also is sort of like an old school operator. You know, you always see them in the old movies where they, oh, you need this person, and they literally like take the plug and plug it in somewhere else to connect, right? So it relays information between the other cortical areas of the brain. And it relays information between the forebrain and the brainstem. So the forebrain, which we do have a diagram of here, is involved quite a bit in movement. And so we'll talk about this part a lot more when we talk about disorders related to movement. We have a whole unit where we focus on things like Tourette's and Parkinson's and things like that. One of the questions I got was, what's the difference between the ganglia and the basal ganglia? Ganglia in general is like an overarching term that just means collections of nerve cells. So collections of nerve cells, they tend to do things like control internal organs. The basal ganglia are things that are very, very important for controlling movement. So if you have a disorder of a basal ganglia, it's going to mean your movements are not controlled in the way you typically expect. So something like Tourette's, that's a tic disorder. People have involuntary motor tics they can't control. So sometimes it might just be like one of these or with a blinking, sometimes it's verbal, right? And that's because the basal ganglia is not functioning in the way it's supposed to. All right. So we do have about 10 minutes or so. So let's talk about if you had your choice between losing your gray or your white matter, which would you choose and why? What do you think? And again, there's literally no right answer because they're both people. So. Anyone need a quick refresher, which is like, yeah, see some nodding. So, all right, the gray matter, and again, let me just do a quick Google search for some nice here. All right, so here you go. This is actually a really helpful little infographic. So the gray matter is about 40% of your brain, white matter is the other 60%. The gray matter, the color is from the capillary blood vessels and neuronal cell bodies. It's made up of neuronal cell bodies. So if I were to look at my dress, the cell bodies have these sort of blobs. Okay, you know, those are the cell bodies. Or again, here it'd be, you know, this part of the neuron, right, rather than the axon. It includes regions of the brain involved in muscle control, sensory perception, and also memory, emotions, and speech. It's distributed at the surface of the cerebral cortex and the cerebellum, as well as you can see here, some of the depths of the cerebellum. The white matter, the color is from the axon. So again, we're thinking this part on my necklace, we're thinking the little lines here on my dress. And it's white because the axons are covered with that layer of myelin sheath and they're also surrounded by glial cells. White matter is the tissue through which messages pass between different areas of gray matter within the nervous system. So the gray matter can be thought of as the actual computers themselves, whereas the white matter represents the network cables connecting the computers together. The white matter is white because of the myelin, which is a fatty substance. And the brain in general can adapt to white matter damage by finding alternative routes that can bypass the damaged white matter areas. And white matter forms the bulk of the deep parts of the brain and the superficial parts of the spinal cord. The cerebellum itself is structured in a similar manner as the cerebrum, with the superficial mantle of the cerebellar cortex, and then they've got deep cerebellar white matter and aggregates of gray matter. So again, it's not like a lobe of the brain only has one or deep. That's what I'm trying to say, right? They're kind of related. So MS would be damage to the white matter because you're not going to have that myelin sheath. Other changes to the white matter that can happen are amyloid plaques, which are associated with neurodegenerative diseases and in particular Alzheimer's disease. So this is essentially when the glial cells can't do their job and clean stuff up, these gunks kind of build up and it makes it difficult to transmit information. And it can actually like eventually degrade the connections between neurons, which are how we pass information. So just sort of thinking about those ideas. What do you think? Gray matter versus white matter? Again, fully recognizing there's no good answer.
There's less gray matter and losing that section metal is the white matter. But then after you say that white matter is actually repairable to different alternate rock, then maybe I would.
Yeah, that's actually a really good point. Yeah, and this is actually something that we didn't realize until fairly recently, maybe within the past 30 years, 20 years maybe, that you can kind of go around and make new connections. And that's allowed our like physical therapists, for example, or speech therapists to find creative ways to help people recover. So for example, later in the semester, we'll watch a video about Representative Gabby Giffords, who was shot through the skull and survived. And she was shot through the left side of her brain, which is where all your like speech centers are. But what they did is they got her to start to regain her speech by singing, which passes more through the right side of the brain. So there are kind of ways you can help people work around that and make those connections. Yeah, I think that's a really good point. That you know, not all cases, but certainly injuries to this area may be reversible, where all gray matter regeneration may be less likely. Alrighty, any questions that popped up for you all in this sort of very frantic review of the entire brain? As we go through each area, each type of disorder, we will focus in again on the areas of the brain that are affected. So we will circle back to this. And then at the rest of the class, we'll really focus on that, where we'll start with, here's the deficit someone could have. Then we're back to, here's what the brain difference would be. But this is just to sort of like, get this stuff in your head, start conceptualizing it. But again, like, I'm not expecting you all to like have perfect memory of this. We will consider it. Yeah.
As far as like the first is, like with what you just said, is it more like structure and like key terms, and then like for example, number 4 on the SGA was talking about how the nervous system is protected and those structures and things, but then
Yeah, that's a really good question. Yes, I would say focus more on like key terms for it. So definitions, what these various types of neuropsych assessments test for, things, what are different parts of the brain, that type of thing. Yeah. When you get to the exams, there will be sort of more of those like pullback questions and short answers and essays. But the quizzes are pretty definitional based. So that's a really good question. All right, I'll hang around for a couple minutes in case anyone has any questions. If not, I will see you on Thursday. Yeah. No, I think Henry, I'm still waiting for an email from you about when you can meet on Tuesdays. All right, thanks for joining us.
Bye, thank you.